What to Do If Your Patient is Undocumented and May Have Breast Cancer by Kinza Siddiqui and Emily Trebell. This is Anna. Anna is a 32-year-old woman who moved from Honduras to the United States about 12 years ago. Anna does not have health insurance, as she is an undocumented immigrant, and undocumented immigrants are generally not eligible to receive Medicaid or benefits from the Affordable Care Act. Anna works at a bakery next door to a women's clinic. One day at work, Anna's coworker mentioned that because it was Breast Cancer Awareness Month, the clinic was providing free mammogram screenings for people without insurance. Anna did not know what to expect, as she had never been screened for cancer before, but she still went to the clinic before her shift the next day. To Anna's horror, the results from the test showed possible signs of breast cancer, requiring a biopsy that Anna could not afford. We understand that, as healthcare providers, you may find it difficult to help out patients who cannot afford treatment, especially since undocumented immigrants are not generally eligible for Medicaid, but there are some ways that you can help. Although undocumented immigrants are not generally eligible for Medicaid, many states or organizations offer resources or screenings to these immigrants. For example, in Anna's case, her provider could suggest her to go to www.texascancer.info, where she could answer some questions to find local resources. She would pick which language she wants her results in, pick which county she lives in, as well as her question. For Anna, the question that we selected was that she had already been told that she had cancer and wanted to know what to do next. The database then shows that Anna may be eligible to Harris Health Financial Assistance Program, and shows the information that she needs to figure out if she is eligible, as well as a list of places where she could go to. The database also offers places Anna could go to if she does not end up eligible to Harris Health's Financial Assistance Program, such as the Cancer and Research Center at UT Health in San Antonio or at MD Anderson. Here are some additional ways you could help undocumented immigrants, according to information from the American Society of Clinical Oncology. If you work at a private practice, you could talk to pharmaceutical companies to find out if you could get low-cost or free chemotherapy or supplementary medication for your patients. Or if you work at a hospital, you can check if your hospital has a charity program, or you could seek donors and funding by contacting private foundations that your hospital has ties with. Also, be aware that literacy and health disparities among undocumented immigrants are common. These disparities stem from several things, such as limited access or knowledge of the healthcare system, government issues, confusion about rules and regulations, and discrimination. Also, undocumented immigrants may face resource barriers when trying to get services. Some laws force these individuals to show documentation when getting healthcare services. But what happens when a child needs healthcare, but their parents don't have documentation? The parent just avoids the healthcare altogether. Or, what happens when there's a lack of translation services and the patient is unable to communicate with their provider? These are both questions that we really need to think about. Also, be aware that there's an overall fear of deportation or being reported as undocumented while utilizing healthcare services, as well as discrimination and stigma based on citizenship status. These may prevent undocumented immigrants from seeking out healthcare services. Literacy is also a huge issue here. A lot of immigrants don't speak or understand the same language as their provider, which can prevent them from seeking help. Cultural literacy is also a challenge. Immigrants have to face and understand nuances of another culture while still having to express their own problems in fear that they aren't fully understood. Here are some tips for healthcare providers to help navigate and lessen these disparities among undocumented immigrants. Providers should receive additional training to appropriately care for undocumented immigrants, training based on cultural competency, as well as training on the current policies in place, because some providers might turn away undocumented immigrants based on false information. Providers should also help educate and have outreach programs specifically for undocumented immigrants, as this will help the lack of knowledge among these individuals as well as put the healthcare system in better reach. Providers should also help delegate cultural ambassadors to help undocumented immigrants find their way through the healthcare system to obtain the healthcare they need. That is the end of this presentation.